Good morning, everyone, and also presented myself just briefly. My name is Christophe Bayer. I'm here heading the team for international health security, and today I'm giving this presentation on behalf of our Chief Medical Officer, Dr. Holter. As already said, the utmost importance of functioning and resilient health system is obviously looking not only at the current COVID-19 pandemic, but also looking on other diseases. We should not make the mistakes that while only looking at COVID-19, forget what else is ongoing here, what else is ongoing internationally on diseases, but also nationally, where we have currently our highest burden of disease. This is at the moment definitely not COVID-19, but we are only or mostly speaking about COVID-19. In the next 10 to 15 minutes, I will guide you through different levels, starting from the global and ending at the local level. And to make it more tangible, I will name some specific institutions at each level. We have already heard of some of these institutions, and these are institutions with which we from the Federal Ministry of Health interact currently most during the COVID-19 pandemic. Of course, even though this does not reflect the complete landscape of relevant stakeholders at the moment. Talking about the global level, looking at the global level, the key institution at the moment is the World Health Organization. It is obvious that we need a strong and efficient, transparent, and of course accountable WHO today more than ever. At WHO, this is able to lead and coordinate not only the response, but also the wider respect of global health. Germany has been and it remains one of the strong supporters of the WHO and continues to give the political, financial, and of course technical backing that is needed. Colleagues of the Robert Koch Institute and many other institutions are represented in a number of technical fora within the WHO. Saying this, we are also a critical friend of WHO, and we ask for challenges of the organization, and we ask for change in this organization. Necessary reforms need to be pushed forward so that both, for example, the emergency program and WHO's work under the international health regulations can be strengthened. Currently, the IHR Review Committee is led by Professor Wheeler of the Robert Koch Institute, and it will be a very important process, keeping in mind that the current international health regulations are a result of what we have gone through SARS-CoV-1, through the SARS epidemic we had early in the 2000s. So it's pretty obvious that right now we will face other challenges, and that this COVID-19 pandemic will, of course, hopefully lead to a further development of the current international health regulations. But I also want to ask you a critical question right now, which we might discuss later during our discussion round. As I mentioned, the World Health Organization, I've already asked myself at this point that how much importance at this moment is the World Health Organization for our day-to-day work. So how often do we look at WHO's website? Do we use the guidance which is currently given by WHO, or do we use other guidance? What is the current status? What is the role of WHO for our day-to-day work? And when considering these questions, there are as well some question marks which are coming up into my head. Now coming to the next level, to the supranational level, and the European Center for Disease Control here is one of the institutions which needs to be clearly mentioned. As you know, Germany right now has the EU presidency as the second half of this year, and of course, again, COVID-19 is very high on our agenda. But hand in hand with this, one of our key goals is to strengthen the ECDC's capacities in terms of human and financial resources to make the ECDC even stronger and to make it more operational. We are also advocating for extending the mandate of ECDC by, for instance, improving its forecasting capacity, giving clear guidelines, creating a comparable database of member states, and developing a digital early warning systems. And when looking, for example, on the current infectious disease epidemiology, the European Center for Disease Control is doing, when looking a little bit outside of the box, we can see that there are a lot of methods which are applied right now in infectious disease methodology, which have strong linkages, just to say it this way, to other sectors of health, for example, environmental health, which very often and even more and more nowadays go hand in hand with infectious disease. When relying on the ECDC data, when, for instance, assessing risk areas and working closely with them, especially the Robert Koch Institute is the partner in Germany, which is working with the ECDC. Coming now to the national level, and I already mentioned our Robert Koch Institute. Thanks to Osama and his colleagues that are continuously monitoring the situation, estimating the risk for the population, giving numbers of guidance for health professionals and, of course, for the population. We are very grateful that we have this institution to give us this good picture of Germany's situation. It is important to know that currently the RKI is giving guidance and recommendation, and it's not enforcing any measures. So just needs to be clear when thinking and when talking about the advice the Robert Koch Institute is giving. The COVID-19 pandemic has shown us that we must act quickly and support others, not only from our desk, but also to be present where support is needed on the regional or local level. That's why we are currently working together with you as well, Osama, on a better operational positioning of the Robert Koch Institute. And this includes as well the ad hoc establishment of further mobile teams to support outbreak management in local settings where it might be needed. The last couple of months, the local public health services have been and are still quite stretched. As it was already mentioned, we are still in the middle of this marathon, this COVID-19 marathon, and I'm afraid that we are not yet at the final sprint. Yes, I want now to come to the local level. Coming now to, at least for my presentation, to the smallest level. This is rather wrong saying it is the smallest level. Actually, I consider this is the most important and this is the strongest level, which we have here, the local level. Colleagues working at the local level, like in public health services, are always at the forefront of combating the COVID-19 pandemic. And we are extremely grateful for the work, and we are well aware of the pressure this is currently put on them. And this pressure is mounting sometimes from day to day even further. And in these days, we can also feel it with the discussions on overwhelmed local public health authorities no longer being capable to do contact tracing for all the contacts which pop up. One might say that the federal system in Germany is a hurdle, but as I already said at the beginning, I would like to stress that it's rather a strength that we have it right now. Thanks to the federal structure, specific needs of the respective regions can be addressed precisely, as the one working on the local level know best which conditions apply on these levels and which measures need to be applied in the current specific situations. As I said, we know that the local public health services are working at the full capacity, and we would like to support them in a sustainable manner. Currently, we are working on the Pact for the ÖGD, and it was already announced, and now this needs to be really implemented in order to make or to add an additional pillar for strengthening the local level. One of the key headlines and topics of this Pact for the ÖGD is that the Bund, the federal system, the national level will invest around 4 billion euro until 2026 for personnel, digitalization, and modern structures. So the aim is in order to achieve a more sustainable increase of the workforce. I know increasing of the workforce is more than only opening new positions. There are a lot of problems in order to get these new positions filled in. Another goal is to set up a comprehensive digital notification system. Osama and many other players, Dr. Teichert, you know this very well, talking about DEMIS as a digital electronic notification system in Germany. And of course, to help to achieve a status where we have more interoperability of data. This interoperability of data was already mentioned by Dr. Slivka before. Coming now to the almost last slide of my presentation, I want to give you a brief outlook. Outlook might be mistaken for a prognosis. Nobody can give a prognosis what's going on during the next months. But to give you some examples on what we are from the Federal Ministry of Health are working at the moment right now with regard to the next couple of months, I would just want to mention some examples. Of course, it has also been in the media that we're working on vaccination plans for COVID-19, but as well as plans in order to increase capacities for influenza vaccinations and procurement of these vaccines, both COVID-19 and influenza vaccinations. We continue our awareness campaign to reinforce the prevention messages, the so-called AHA-Regel, of keeping safe distance, ensuring hygiene measures such as washing hands and wearing face masks. And of course, they are now the letter L for lüften or ventilation will be added to these AHA-Regeln. And the C for the Corona Warn app using this digital system will be added to the AHA-Regel. I'm quite curious how this will be pronounced, AHA LK, or how this will flow with the now already well in our mind having these AHA-Regeln. But let's see. Currently, we are also adapting our national testing strategy to ensure the health workforce and people in health and rehabilitation facilities, in care homes, and in facilities for people with disabilities are better protected. But not only for them, there are also other ideas which are currently discussed. And our minister yesterday, for example, has spoken about the potential. Just underlining the potential, we are not there right now, of home testing and so on. And mentioning home testing and the potential, we are not right there now. I just said this. In addition to the PCR, we plan to introduce, of course, point-of-care antigen tests in certain settings, in situations. And this can be one additional little pillar to really fight and to make it to come up with a game changer when it comes to fighting COVID-19. I also want to mention that we continuously monitor the availability of free intensive care, ICU beds and capacities. Together with the DV, there's this DV register, and this should allow us to better transfer patients, to better allocate patients when in certain areas capacities might be overstretched. We hope that we definitely will not reach this point, but I think we are now better prepared to have a better dispersed system and a better system for dispatching patients. Also wanted to mention briefly the Corona Warn app, which we have established, and we are currently working on making it more interoperable at international level, in particular at European level. And while already talking about European level again, we are working in the next months as well, or right now even heavily, with the European Commission in order to agree on European level on common criteria on when area is considered as a risk area. Having almost 30 member states in the European Union, you can imagine that it might be quite hard, but hopefully we will reach this point that we will agree on a common set of criteria to define risk areas. As currently being the EU presidency, we have perhaps a better position to push this process, and we use this. What else are we working on?
Please.
Yes, what else are we working on is, for example, just yesterday we had the EU Chief Medical Officers meeting talking about international contact tracing. And international contact tracing, it was one of the topics which was already chosen before the COVID-19 pandemic hit us. I would just mention one last example before ending this presentation. At the European level, there's also the joint procurement. And we hear also a lot of bad things about joint procurement when it comes to COVID vaccination and so on, but there are many positive sides of it. And I want to underline this European dimension needs to be used not only for, and is used not only for COVID-19, but also for other diseases. For example, currently we are agreeing on stockpiling for example, Ebola, medical countermeasures, vaccines, and many other diseases, rare diseases, where you might need medical countermeasures immediately. Now, coming to the end, thank you for your attention. And I just wanted to underline again that we're still running, in my opinion, on this marathon. And unfortunately, it doesn't seem that we are already doing our final sprint now. Therefore, I wish all of us a lot of energy, and thank you very much for your attention. Happy to answer questions and further discuss with you later during this session. Thank you very much.